So back in 2020, we had a sudden departure of doctors in Dawson Creek. We were left with a midwife and 2 primary providers to take care of all of our delivering patients in the South piece. And it became impossible to do that as individuals.
To be honest, I was kind of on the fence about quitting this career. I love this job. I find it very satisfactory, but if you don't have other midwives in town, you're solo. You answer the phones, you book the appointments, you send the consults, you do all the deliveries, all the on-call, the home visits, and I felt very isolated as a provider. And then just as a human being, it was a very lonely job.
And the purpose of the JSC is really about recruitment and retention of physicians in rural communities. So Rome was really set up to try and stop the bleed of obstetrical services from rural communities and stop that centralization of services.
We actually approached the health authority, who suggested we apply for Rome funding. And with the Rome funding, we were able to get a group together to work as a collaborative team.
The roles, the pathway for the patient through the clinic, communication amongst the team, conflict resolution amongst the team, and then how do we build out a clinic that's really functional, that we don't, nothing falls through the cracks. It was Rome funding that helped us figure all of that out.
Then put it out to the public. What do they want to see? How do they want their care to be like? And the public then also voted on the name for our clinic, and subsequently it became the Chickadee Maternity Collaborative.
It's been incredibly impactful for me because I've had such a complicated pregnancy. It's been really nice knowing that, the physicians are just down the road. I feel like I'm not just a patient here. I feel like I'm able to connect with the physicians and the nurses, and they've really been there for me.
Was giving me more time with my family, which is what's the most important thing. So the model has ensured that we can have time off. We now work on a schedule. I'm not on call 24/7 any longer.
I think it's a huge step forward as a registered midwife to be integrating with physicians and nurses and obstetricians. Midwives have been working very, very hard to be a member of the team and at the table, as we like to say. And it's this funding from Rome and the focus on collaboration that has allowed that to happen.
When you work in this collaborative framework, all of your efforts, all of the work can go into the work as opposed to the struggle or the fight. When you've got that safe space, you get lots of innovation and new ideas, and gives us a real opportunity to look at potential positive changes for the system.
It's important for providers to know that there is resources that can empower them to improve difficult situations within their communities and build programs that's unique to them that can improve healthcare access and services for everybody in their region.
This clinic, so Chickadee, the women especially, are being able to be quite supported here in our community. It feels safe to be able to grow a family here.
So if you think of the impact of Rome funding a clinic like this in a small town like this, we're keeping birth in the community. We're allowing our highly experienced maternity care nurses to remain in maternity care for a longer amount of time. We have stability with the team. We have stability in the community. And people in Dawson, they stay, right? And that's just a really beautiful thing. It's that spirit of community.